best answer is for family and friends to support them with transportation. If we're talking about sending a cab to them, the risk is just as great as if we're sending a family member or a friend that might be able to transport them to the site. Obviously, public transportation is an option. I get that for some folks that might not be accessible, and or they might have concerns about exposures there. We're doing everything we can to make it as available as possible. Right now, our goal is to get as many people vaccinated as we can with the supply that we have. And the efficiency of a large-scale singular site allows us to do that most effectively. We'll continue to work on transportation efforts, but we've already seen, just yesterday, we saw family and friends bringing their senior family members to the clinic, and I would encourage folks to try to find ways to make that work, at least at this point.
Okay, all right. I think we, if we need, I'd like to just keep thinking about that, because I'm just afraid of these people who we've been telling them not to be with family and friends to expose them in a car ride. But anyway, I want to just keep thinking about that. Thank you.
Thanks, Annie. I also echo Annie's concern. I think many of us in our districts have senior living. I have senior apartments, the Ellis Hollow apartments. I know Annie has, I believe, 2 different senior apartments. Amanda has some, Deborah has some, and so I think that, we have a population that's not driving, that's not always comfortable scheduling their own transportation. And at some point in the vaccine process, it would be great if we can actually have someone that can go on site and provide these vaccines to our seniors.
Shauna?
Oh, go ahead, Deborah.
I will say that, some of the larger senior facilities like Kendall arrange transportation, and I'm sure that they're going to be on top of this for their residents. But the other piece is some of these senior living arrangements are close enough to the TCAT routes to avail themselves of gadabout. So that's also an option.
Thank you, Deb.
And Dan and I are both on the TCAT board, so we can see if there's something we might be able to work out with TCAT and gadabout so that they're more responsive to this particular need.
That would be great. I think my specific concern was that not everyone is able to step up on a bus or get in a car, and so they might actually need the gadabout, the chairlift, to help them with that. So thank you very much. I have Amanda, and then Martha, and then Henry.
Thanks, Jonna. Thanks, Frank, for the update. I was just wondering about the I remember there was talk about having a West Hill testing site at, I don't know if that's at the hospital, or has that already opened? Sorry if I'm going backwards in time.
I honestly don't know the answer to that question, Amanda. I've not been following testing recently. I don't know.
I think, Amanda, so the site you're talking about, they did open the 3rd site at the hospital, and I think that was, so there's the site down on Tioga Street, the mall sample site, and then there is a site open at the hospital for kind of the west side of the lake. So I think that's what you're referring to, that conversation, and it is open. It opened last week, I think.
Okay, great, thank you.
Sorry, I confused West Hill with East Hill. Like, yeah,
no worries.
The hospital site is open for testing. Yeah.
Great, thanks, Amanda. Thanks, Frank. Martha, and then Henry.
Thanks, Jonna. Frank, it's easy to confuse East and West when we haven't seen the sun in about 2 months. So usually that's a clue. Are we in touch with the pharmacies, like to get, and are we at any point sort of going to have a comprehensive list, or will we know how we've done in Tompkins County and what populations have had less success and that sort of thing?
Yeah, so we're efforting that now to figure out how we're going to find out what's going on with the pharmacies. honestly, we're finding out from the governor's press conferences how this stuff is rolling out. So we're trying to get caught up as quickly as we can. The pharmacies themselves are doing some advertising about it, and so when we see that, I think we're trying to link that with our stuff. The state site is supposed to have every site that has vaccine registration available. So if folks go through that process, that should also help. But yeah, we're doing the best we can to understand where the vaccine is going and who has it. But as we've seen, really before we even know it's here, the slots are being taken up at this point. That will change eventually as demand and supply kind of equalize out. And so we'll make sure that we have as much information on our website as possible about where it's available.
Yeah, I was sort of thinking more like, do you have a contact, a person that, the general manager or somebody at each of the pharmacies, so you're in direct touch with them? I thought maybe that would.
Yeah, I mean, we work with the pharmacies on multiple other issues. So we do have contacts there, but quite frankly, I think they're finding out about this in real time as well. So they're trying to get up to speed as well. But yes, we are working on a plan to be in regular contact with the pharmacies.
Okay, great. What can you tell us about nursing homes? Have they been able to get staff and residents vaccinated?
So that is a challenge. I don't know the totality of what's been done because it's a federally run program that the state opted into. What we are hearing is that not all of the long-term care facilities are done, and it could be weeks before their appointments are before someone comes to their facility. It's challenging because there's vaccine that's been pulled out of New York State's allotment to supply that program. And so if we take vaccine out of the allotments that we're getting to do that, we're losing vaccine availability in our community. So we're really trying to understand from the state what their solution to this problem is, to try to get folks in those settings vaccinated as quickly as possible. But right now it is still being run by the state and the federal government.
Wow, this is not, oh, never mind. Are we holding back a second dose? Like when for the 1,000, the 2,100 we did last week, do we have the second dose in reserve? How do we do that?
No, we don't. The federal government is doing that. So whenever they send the states an allocation, they are supposed to have the second dose stored or at least accounted for. And then what is now beginning to happen is second doses are being sent to the vaccination sites. For example, the hospital is expecting to receive this week their first round of second dose vaccines. And those vaccines, when they arrive, are earmarked for second dose. You can't use them for first dose. So it's being done at the federal level. I think we've heard President-elect Biden talking about not holding that back at the federal level and just using every vaccine for first dose at this point. The information piece that we don't have is what is the manufacturer's capabilities, right? Somebody at the federal level should have that information and should be making decisions based off of what the expected production levels are going to be as to whether they need to hold back or they can be confident that that second dose will be available when it's needed. So we're not really in that process other than we get the hospital at this point gets the earmarked second doses, and we'll be setting up clinics for those folks that got the first.
Got it. Okay, that makes a lot of sense. All right, and as I said, for legislature meeting, if there's anything that we can provide that y'all need that you can figure out that will improve the situation, don't hesitate to ask. Because Shauna will take care of it.
Got it. I've got you.
Thanks very much.
Let's see here. I have Deborah Dawson, and then Dan.
Just a quick question, Frank.
Your hand went
Is
down.
there some optimal time
I
frame?
gotcha. She's on the committee. You're not.
Second shot. I mean, can you go too long before you get your second shot and it's effective? How does that work?
Yeah, I'm sorry, Deb. I don't know the actual guidance on that. It's not vital that you get it on the 28th day. We would certainly encourage people to follow up. But the state has told us that when you get your first dose, you must go to the same location to get your second dose. Right. And the reason for that is what I just described. Those second doses are being allocated based off of where the first dose is given. And if people start going to different places, the allocations are going to be off. So it's really, really important that people get their plan to get their second dose where they got their first dose. At the clinic at the mall, you don't leave until you've scheduled your next appointment. So we have it set up while you're waiting your 15 minutes for observation. There's people there helping folks register for that second dose.
Okay, thank you. So it's 28 days, at least in theory.
For Moderna, it's 28 days. For Pfizer, it's 21.
Thank you.
Okay, we're going to go Dan since he's on the committee, and then Henry. Sorry, Henry. Next year, maybe you'll be on HHS.
Frank, thank you. I just wanted to make sure I heard correctly or clarify. So seniors, 75 and older, are supposed to go to drugstores, pharmacies.
That's the plan that the governor has, that the pharmacies are the primary location for 75 plus. 75 plus are welcome to come to the mall. We are happy to vaccinate them as well, but vaccine right now is being diverted to the pharmacies for the 75 plus population.
Thank you.
Okay, Henry Granison.
Thank you, Shauna. Frank, I was wondering, well, two questions. One following Martha's question. Will there ever be a time when one group knows how many vaccines are being sent into the county?
I'm sorry, can you ask that question again?
Is there ever going to be a time when you or the hospital knows how many vaccines are being sent into the county?
The state is trying to tell us that information now, but quite frankly, it's hard to keep track of because there's so many, there's just a lot of different entities handling vaccine at this point. So the state is trying to get a handle on that so they can report it. They did send us a note yesterday to Jason with what they believe was the allocation for this week. And so that's how we know about the pharmacies that are getting some doses and how much. Hopefully that will kind of solidify here in the next few weeks and it'll be more clear about the totality of vaccine coming in. The only concern that we have is the governor's talking about increasing the distribution system, which I think in the long run is a good thing. But that means there's that many more people getting vaccine and it becomes logistically harder to keep track of. So the short answer is they've told us that they're going to try. I don't know that we're there yet. Also, second question, will there be a point in time on the website where they will book ahead or they're constantly going to just book ahead when you have vaccine delivered? Yeah, right now we've been told we're not allowed to advertise appointments until we have vaccine in hand. So that's the method that we're going through. I would imagine at some point supply will outpace demand and then there will just be open clinics with slots that are available for folks to sign up for. But right now, as far as I can tell, any site that puts out appointments is filled very quickly. Okay, thank you.
Great, I see no more questions. Thank you very much, Frank, for coming today and answering all of our questions. Okay, next on the agenda, Jason, did you have a report today?
I don't have anything more than what you've already covered today. Just to say that Frank and the team have done a great job down at the site. You know, what we continually hear back from our state representatives is that we have the best practice in the region and that we're vaccinating more folks than more in our region and outside of it. And I think that's a direct relationship between the relationship we have with CHS and the cooperative partnership we have. So it's been, it's good for us. And when we were able to do this with testing, we're able to do it with vaccination. So just to compliment the staff for working hard, Frank, Amy, Dom, the folks that are down at the site, both CHS and our staff, as well as our folks still at the public health department maintaining disease surveillance. And that shouldn't be forgotten throughout all of this. Just because you get vaccinated, you still have to follow the same process, you know, Same steps, same preventative measures, mask wearing, good hygiene, distancing, less density, so on and so forth. So that's all I have. And get vaccinated when you're eligible. That's how you can help, when you're eligible.
Great. Thank you, Jason. And let's see here. Why don't we move on? We have one resolution and one appointment, and I want to go ahead and move those right now so that if any of our committee members need to leave, we still have enough to vote for those. So if I could have a mover for resolution ID 9842, 2020 Tompkins County Office for the Aging Budget Adjustment for the State-Funded Unmet Needs Program. Moved by Klein.
Shauna?
Yep. What's that, Deb?
I'll second it if Glenn moved it.
Okay, Glenn will move. Deborah will second that motion. And Lisa Monroe, hello. Can you provide us with a little analysis for what this resolution is for?
Sure. Yeah. Once I understood it completely from my fiscal person this morning. Yeah, it's been an interesting budget year. I'll just tell you that much with the CARES funding and, moving money around between lines, and it's like whack-a-mole. That's how we explain it. It's what it feels like. So basically, this is just an increase in revenue to cover the expenses that we have. Because the state extended this allocation, basically. And we kind of made a little bit of a mistake in anticipating the expense line. So it's just moving the money over to cover it.
Okay, thank you. Are there any questions? Dan Klein?
Yeah, it seems to say where the money's going, but not where it's coming from. Am I reading this wrong? Doesn't it usually say, revenue account? That's where it's going, but where's it coming from?
The revenue account, 6, 7, 8, 9.
Yeah, it does.
Then I got to get my cheat sheet. So it's unmet needs funding. It's the unmet needs line. It's 6798. It is just basically the money was for INHS. It came out of, and the money was covered initially. We have 2 grants with INHS. One is a county funded grant, and one is this state funded unmet needs funding. So it was kind of like we basically used the county funding to cover the expenses. Then when we got the extension, we had a deficit. We were putting the money from the unmet needs back into that 798 or what? Yeah, 6798 line to cover it. It's kind of, again, it's like a cup game, kind of moving money around.
Isn't there another account line it's coming from though? Isn't that usually indicated on these kind of resolutions?
It does say revenue account line, the A6798-43803. It's just it's overwritten by the side margin.
Mm-hmm.
So that revenue line title?
Yeah.
So revenue account is where it's coming from. Appropriation account is where it's going to. And it's on one line.
Thank you.
Yes.
Sorry.
Thank you. Yeah.
Sorry for the confusion. Thank you.
Yeah.
It is confusing, Dan. I was confused too.
It is confusing. And it's because the grant ended, then it was extended. So we were able to pull the money forward, if that makes sense.
It does. Thanks.
Okay, thanks, Dan. Are there any other questions? Okay, if we could do a roll call. Dan Klein?
Yes.
Amanda Champion?
Yes.
Deborah Dawson?
Yes.
Glenn Morey?
Yes.
And I am a yes, that's unanimous. Thank you very much. And the next thing we have to vote on is an advisory board appointment for the Human Rights Commission. Can I have a mover to appoint Peaches Gillette? Her term would expire December 31st, 2023. Moved by Amanda Champion. Seconded by Dan Klein. And are there any questions on this appointment? Okay, I see none. Let's vote for Peaches to be on the Human Rights Commission. Dan Klein?
Yes.
Amanda Champion?
Yes.
Deborah Dawson?
Yes.
Glenn Morey?
Yes.
And I am a yes also. That's unanimous. Thank you all for being flexible. and allowing me to adjust our agenda a bit. Now I would like to introduce Jeanette Batista Harrison, who is the consultant that we have hired to help us with the integration of public health and mental health. And she is here to give a presentation and an update today for us.
Thanks, Shauna. So I just want to do a quick time check before I get started. My understanding is that I have 30 minutes. Is that correct? Or do I need to adjust that at all? I just want to make sure I don't.
I think 30 minutes should be fine.
Okay, and so I'll make sure I don't go over, and if I go under, I'll definitely give you back the time there. Let me start by sharing my screen with you all, which you guys should see here. I'm going to start from the beginning. Does everybody see my screen?
Yes.
That work? Okay, good. So thank you all for having me today. I'm of course wish I could be with you in person. There's always something about presenting to my camera that feels less genuine than when I'm actually with people that will make the most of it. So I'm happy to be with you all today. And on behalf of Batista leadership, talk a little bit about the work that we've done with Frank, the team, public health, and mental health departments. Let me start by just saying a little bit, just historically, you know, it's been an interesting, I mean, what an incredible year, right? Like I think about hearing how busy you all have been over this year, hearing Frank's report, and then also working with the organization to push this strategic planning process forward. It's been really incredible, amazing, a testimony of what we're all capable of doing in that sense. We started working with Frank actually prior to the vote to actually merge the two departments. So initially he, when they did the RFP and brought in the consultant, there wasn't a clear definitive answer that yes, the two organizations were going to come together. So the premise of the work was strategic planning and staff development for the public health department. As we kicked off, and shortly thereafter, if you guys recall, this would have been back in 2019 now, as we kicked off right at the beginning, so the timing was ideal because right at the beginning came the vote and then a quick like rescoping of what actually has to be done here, appreciating the fact that the integration of the two departments was like foremost when we think about the strategic planning process ahead. So everything kind of shifted. I think that's been kind of a theme in the work that we've done is this like continuous shifting because who would have then thought that COVID was coming, right? So what I'm here to share with you today, I think I have, so just as a quick agenda, I just want to talk a little bit about who we are as an organization real quick so you get a sense for our philosophy. And then I want to share kind of the status, like quick overview of some of the major moving pieces, like some of the big chunks of the work that we've completed. We're coming to the final draft of the strategic plan. So I'm going to share some of the high level components of that plan with you, and then just do a quick, like what is left to be done with our work with the organization. Any questions before I start? Move through these slides. I always have to kind of like look at the thumbnails to see if somebody's saying anything. Okay, so here we go, a little bit about us. So I share this picture first as a mountain because I think it's very symbolic for us, our philosophy as an organization. We say and we believe that leadership is a journey for which there is no summit. And by that, we mean that like no organization, no team, no individual leader ever gets to the top of the summit and plants a flag and arrives. There's always like more to learn, more to do, a new challenge ahead, new opportunities. And also there's forces that work against the team on the journey that could push you back down the mountain, figuratively speaking, right? So we never get to the top. And our role then here coming in as a consultant was to support. I love that mountain too, Amanda said, so you might recognize this. This is in the High Peaks region. But yes, so love the mountain, love that area, love New York. But so our work here with the organization was to help like accelerate along the journey and to create the roadmap, the plan, and to align the organization around a shared vision for success. Like where are we headed over these next 3 years? Of course, that's been a very interesting question when we think about what's required from any organization to be agile and flexible and innovative, right? So how do we create alignment and focus, but also give the organization enough space to respond to some of the immediate demands and pressures that are ahead of us? So with that, again, share, let's see here. Okay, so this slide here, when just a little bit more about what we believe in our approach to the organization. Again, it's all about alignment. And so oftentimes when we talk about alignment within organizations, I'm sure you all have heard this rowboat analogy, right? Or the rowing analogy of everyone get an oar and row in the same direction. And that makes a lot of sense when we think of it in terms of like, well, yeah, of course, everyone get an oar, everyone row in the same direction. When we apply the analogy to any organization, to business, to nonprofit, to government, the real challenge is ensuring that everyone understands how to win. Like, where is the finish line? Where are we headed? What are the rules of the game? And so our focus here then, as we come in thinking about like the future, the roadmap and alignment, we have approached the organization through these 4 different quadrants. And I'm going to present a little bit about all of them at a very high level, recognizing the time we have. So alignment around a shared purpose. The purpose being like, why do we exist? And what is the impact we want to have on the world or our community, on Tompkins County? And that's been a really important question as we think about aligning the 2 organizations as they become one, as they are now one. A shared intent, answering the question, what does success look like in 3 years? And then shared values and of course, shared culture. And so these have been the 4 different quadrants in which we've focused our thinking and our work with them over these past many months. So I want to talk a little bit about the work that we've already done. And it's not been a normal year for any of us, particularly, you know, when we from the time we launched until where we sit today. So phase 1, and this is now we're going to think backwards to the last quarter of 2019. Phase 1 was largely preparing for change. So we knew that change was on the horizon. And so some of the pieces to that included work with the senior leadership team, so that way to at least like establish a shared understanding of what the change was going to look like and where we were headed. A change readiness survey, which went out across the organizations, mental health and public health. And a community capacity assessment, which assessed the community's understanding. It was largely a feedback survey to the organization from the community. And all of that was done in Q4 of 2019. We moved forward from that phase 1 into phase 2, which was more of a launch. And that included a number of meetings with the leadership team and also with managers. It also included an all staff retreat, which was held in November of 2019. Again, all of this pre-COVID, even before we even knew what was going to be coming. And then we scheduled out and began, as we closed the 2019, we launched 2020 with an expectation of moving through the planning process and launching the plan. Of course, all of that changed. We learned early on in February that things were not going to look as we suspected, and quickly, like what we thought, like a map and all kinds of, the meetings and the sequence that we had together, like scheduled, all of that was postponed. And then, of course, we moved into the intensity of COVID. There was a quiet period through the summer, but where we did reconvene, and when Frank and the team were ready to reconvene and refocus on this. And so we rescheduled all of the strategic planning process through September and then till now, and everything switched to remote work. So all of the plan, all of the work that we did with the staff planning committee, the advisory committee, and the leadership team into 2020 was all done remotely. And during this period, we've had 7 planning meetings with the staff committee. So the staff committee has done the majority of this work, and the staff committee is made up of representation from public health and mental health, cross-cutting throughout the organization, representation on this committee, and there's about 25 members in that committee. We've been doing a lot of work as well, and we'll continue as we move through this month to sync with the leadership team. And then there was an advisory committee that was established, which included representation from the boards, from both boards, for mental health and public health. And so we've been working with them as well, iterating the plan and soliciting feedback, input, and the like. So we feel really good about the participation. We're just in awe of their commitment, given everything else on their plate. I mean, it's really hard when you're in the close fight, when you're in a crisis, to step out of that space and think long term. And I just really commend their ability to switch gears in that way and dedicate a lot of time to this work. Let me pause here and ask if there's any questions. Okay, then I'm going to keep going. Do a time check. So let me then share some, at a really high level, some of what has come out of the planning with the committee. So the first piece of it here is their joint, and this is all now thinking about an integrated organization. The name still to be determined by staff, by the organization. But when we talk from here on out, we are absolutely, just to reiterate, we're talking about a unified, one department, mental health and public health coming together. So this being a shared mission statement that has come from the staff planning committee. Their purpose, like why they exist, is to build a healthy, equitable community in Tompkins County by addressing the root causes of health disparities and integrating mental, physical, and environmental health. So this being kind of their articulation of why they exist as a shared, one united organization. I'm going to move on here just to share as well kind of what they articulated as their vision, the impact they want to have on Tompkins County, like what they envision for their community. And jointly, they articulated that they envision a future where every person in Tompkins County can achieve wellness. And so what you can see here in some of the language in both the mission and the vision is really like mental health and public health fitting underneath this umbrella. So the words here were inclusive of both organizations and the really unique services that they each individually offer, but all in the name of health and wellness and helping out the whole person. Let me move on then. So we have this mission and vision that they drafted, and then we moved into some more granularity, which we call their intent. Answering the questions: how do you define success? What is the desired future state of this organization? So if we can think out 3 years from now, when we come back and peek in, what will we see, right? Like, what are you building? And then from there, what are the high level priorities that are fundamental in order to achieve success? And so this is where we also dove in with the staff committee, receiving input and feedback from the advisory committee and working alongside the leadership team. So a lot of feedback. So what I'm going to share with you here now is the very high level. So I'm going to try to give some justification behind the different priorities and present it to you. But of course, there's more granularity in the specifics of the plan. So their desired future state as an organization in 3 years, right? Like, what would we find? And the answer to that question is an integrated and empowered team advancing a collaborative effort to promote prevention and equitably improve individual and population health, right? So this is kind of where they're headed, what they want to be. And it's very much internal to the organization. There's a lot of work that needs to happen around here. This integration, the heavy lift, like the work ahead is not a simple task, but you can see that they're very committed to that work. So here being the desired future state. And then what I want to do is share, they have 5 priorities that they've identified that are fundamental to achieve this desired future state. And this is where you start to see some more granularity around the work. So the first priority, and a lot of these, let me just say before I get into this, is that these priorities were identified through, of course, the staff survey, the community survey, and then all the work with the different committees. The first being here, culture. And this is important because what was identified in the staff survey was that there were very different cultures from mental health and public health, right? A very different experience. And they talked about very different cultures within the 2 organizations. So this first priority here, when we talk about integration, is about aligning the organization around now a shared mission and this shared culture to create the empowered, engaged, and cohesive team. So a lot of work here, and when you look into the plan and start to see some of the granularity, you see reference to this uniting of the 2 organizations to build this desired culture that's very much grounded in equity and inclusion, and drawing on the work and experience from the JEDI committee and other committees that are working in the county. So culture being the first priority that they've laid out. The second priority that they've laid out for their organizations is what they're calling integration. And as you can see here, it says merge the department structures to become one organization and increase our ability to better serve our clients and community. So in the integration priority, when you look into the details, what you see are some of the specifics around what it takes to be fully integrated structurally. One name, one logo, one look and feel, all of the media correspondence. So a lot of work needs to go into digging into that. Also assessing the organization structures and looking for overlap or opportunities for collaboration, whether it be programmatically or administratively. And even details about like office locations. We know that mental health is in one space downtown and public health is largely in another space. So they've done a lot of work talking about, how do we share and coexist, right, together, so that way we truly are feeling integrated. So the granularity of all of that comes through in the plan as well, but integration being their second priority. The third here is services. Which is somewhat very much compatible to integration, but it's slightly different. It's different in that the focus here is around coordinating services and capabilities, and to support the whole person and integrate prevention techniques to holistically improve health outcomes. The justification here is that there's a lot of opportunity to better support the whole person when their services are there's a deeper integration of their services. So the work ahead here is about building internal familiarity within the two departments, so that there's a greater and a more universal understanding of programs and services, and also developing this internal coordinating capability, right, where you can have internal referrals and shared clients to better support the individuals in the community that you serve. The fourth priority here, and again, these are, I'm sorry, I'm listing these, but you can see they're not numbered, and they're not numbered because one is not more important than the other. And so that was a very intentional thing. We can't avoid the process of putting them on the paper, but all of them are really important. So the fourth priority here is the community. Strengthen the collaborative effort within Tompkins County to equitably impact individual and population health. Some of the granularity or justification here is around, the communication with the community, the sharing of the merger and the integrated approach and the why behind that. Developing a network map to illustrate overlaps and connections, service gaps, intersections of services and programs across the county in order to better serve, to identify gaps, to identify duplications, to be more effective overall. And then also a plan to reach and engage partners within underserved populations. So to do more to lift voices of people that otherwise don't have a voice at this point. And so a lot of work to be done under community. And then last but not least here is data. To review and establish effective data collection and to measure programmatic, organizational, and county progress against the other priorities. There's a lot of data. You all know this. There's so much data, and the two organizations are very different, even currently, in terms of the way in which they collect data and the way in which they use data. So part of the integration process and part of the focusing on the whole person is to streamline the data collection within the organization, and to use the data to make decisions and to further advance the mission and the priorities of the organization. So here is like a high level, and of course, again, a lot of detail under each of these, but recognizing in 30 minutes, it's hard to, give you guys a good picture of what the work that lies ahead and where they are headed. But I believe this gives you kind of a good snapshot into the deep conversations that we've been having over these many months. Let me pause here again and see if there are questions. Martha, did you have a question?
Yeah, thanks so much. Jeanette, could you be a little more concrete about what the culture, what do you mean by the two different cultures?
Sure, absolutely. So when doing the staff assessment initially, there were questions that were asked specific about the organization's cultures, perceived, and then perceived, whether it be perceived or whether it be real, and then specifics around what that looked like how they were different. And culture being behavioral norms, like what it's like to work there. And so what surfaced through those conversations and also through the surveys was that there's defining different cultures, a different feel of the organizations. And so the opportunity then is to unite, so that way, no matter where you go organizationally, whether it be in mental health or public health, and then as the two merge, that there become these shared norms and behaviors in terms of how they work. And what I'm going to share next are some of the specific values that they identified. And from there, they got granular about what are some of the behaviors that we want within our united organization to define our culture. So they've also done a lot of work around where they want to go, like what they want to see when you come into mental health, public health, when you come into the department. What does it mean to work there? How does everyone work together? Does that answer your question?
A little bit, yeah, thanks so much, appreciate it.
Yeah. Which actually is a good lead into the next slide I have, which is specific to the values that they identified. Any other questions before I move into that one?
I don't see any other hands.
Okay, so the next slide then, part of our strategic planning process, let's see here. Okay, also includes values and culture. The culture being the specific behaviors that are identified because of each of these values. And these nest into the county level values, the values that the county identified before. I know that the leadership team took what they generated in terms of what do we value, what is important to us in terms of how we work and how we serve, and they nest into the county level values. So we see them as being very compatible. But what they identified organizationally, and this was done at the all staff retreat, so every single staff person at mental health and public health weighed into this conversation around what do we look and feel like on our best day? Like, what is it that we espouse to be, and how we want to live and work? And so the first of these was learning. And this dives into, and again, they did the behavioral work around what do we do because we value learning. But I'm not sharing that today just because of time, but I can give a little bit of a summary here. This learning being that like we getting into like sharing ideas, constructively speaking up, encouraging other people to do the same, understanding unique perspectives and differing ideas, taking risks, and trying new ways of working, like this continuous learning to do better. And I think that what's really exciting about the integration of the two departments even is that in and of itself is a learning experience, because it's something very unique, even in New York State, across the United States, this kind of approach to wellness and health. So a lot to learn there. And I think this value of learning really encompasses that kind of spirit within the organization. Another value that they identified being innovation. And this gets at creativity and welcoming alternative ways of doing things, like looking for new solutions in the workplace and seeking out opportunities to expand their impact. I think what COVID has proven is, or has, the silver lining in that sense, COVID has essentially given opportunities for innovation. When you look at like even an example of the telehealth and the way that the mental health department has been able to work with clients and individuals remotely, virtually, it's just an incredible example of innovation in action. Collaboration being the third here, and this is critical to how they work, particularly with a very much community focus. The collaboration as a word means, in its Latin root, means to work jointly with others, right? So when they identify in their work that their strength and their ability to do more comes from their ability to work jointly with others within the community, and also to work jointly with the people they serve. And so collaboration encompasses that. The second here is compassion. This being an incredibly important value as it relates to the intimacy in the work that they do, of having compassion and embracing diversity of lived experiences with an open mind and without judgment. It gets at like behaviorally how they treat each other and how they treat the individuals and the communities in which they serve. And then last here, they have integrity. And this, the behavioral granularity gets at striving for excellence, assuming the best in others, and keeping their commitments to the community. So that's in a nutshell kind of what the work, and as I share this in just a few slides, it's amazing the amount of debate and discussion and conversation. And what we're really excited about for the organization is that it came from within, and believe that believe that that what I'm sharing with you today is a summary, if you will, of many conversations. So the work ahead still, we're not done yet. We need to finalize the plan with the leadership team. At this point, it still very much says draft on it. It's not a complete, it's not complete. And of course, as we've moved through this last quarter, we're working alongside all of the committees. There have been some that needed to be rescheduled because staff have been pulled in different directions, understandably, right? So we're moving to the end, and we're really excited about seeing the completion of the planning process. So we're going to finalize the plan. We need to present the final plan to the advisory committee, which, as you recall, it's the committee of both boards. We're going to work with the leadership team and the managers to share an implementation process that we would recommend to go alongside the plan. The implementation is really, as you all know, where the rubber meets the road. Many organizations will complete a strategic plan only to put it on a shelf. And we understand that, we understand why. And so our work with the organization, with Frank, is to ensure that doesn't happen and to give them the tools they need to move into implementation in an engaging and empowering way. Share the plan with the organization, of course. And then as I talked about, this implementation process, we're going to encourage and give a methodology for using cross-functional teams to implement this plan. And so the next step, once it's finalized and shared, would be to launch the first cross-functional committee for implementation. And my sense, I don't have like confirmation in this, but my strong sense is that the first cross-functional committee will be established to execute against the integration priority area, that will be a primary initial launch. And of course, managing the incredible workload ahead with in response to COVID, and execute against some of these, the priorities that they laid out. So they have a lot of work to do. I'm going to stop there.
Great, thank you so much. Are there any questions? Amanda?
Yeah, thank you so much for giving us this update. Excuse me. I was just wondering what the timeline is for, like, they have all these next steps, but are you looking at a month? Are you looking at another 6 months of, and I know that's probably all variable based on COVID, but.
Yeah, that's a good question. Thank you. So I appreciate that question. A lot of the, what you see here in terms of next steps, we're wrapping most of this up in January. So like, let's see, the finalizing the plan, the advisory committee meeting, we're meeting with the leadership team at the end of January, that's scheduled. We're going to move into February a little bit. And then I know they're working internally right now and thinking a lot about, what makes sense for a first step. How do we, accelerate the implementation of this plan, push the organization in that direction, but not exhaust like people's time, talent, energy, given the COVID response. So the implementation part, like the launch of the first cross-functional committee, that's still undetermined in terms of timeline, but I know that there's a strong feeling of let's move forward, even small steps, right? But not to lose momentum right now, given like everyone, there has been so much momentum built up. How do we move forward in small steps without exhausting the organization's capacity? So all of this being like happening right now, through January and into February.
Great, thank you.
Thank you. And Jeanette, if you could turn off the share screen, that would be great. That way I can see that
definitely.
better.
Yep, there we go.
Okay, thank you.
Mm-hmm.
Dan Klein?
Thank you. So I have voted against this at every stage that it's come, against this integration, and I continue to be unconvinced that this is an advantage. So my first question is there any part of the work you're doing that is a reevaluation of the basic premises of this? Or is that just not in there? This is like full speed ahead.
That is not part of our scope, no.
Okay. And then so I'm not speaking directly to you then, Jeanette, but I would say that you mentioned something, the survey of the staff was, what do we look like on our best day? And I would put it out that we actually need to be planning for what does it look like on our worst day. Mm-hmm. And I don't mean by the, how well people are doing. I mean the circumstances that we find ourselves in. And so in my opinion, the circumstances we find ourselves in have only reinforced my belief that this is a bad idea, that it is going to diminish the strength of each department rather than amplify it. And that I think we see that, there's a lot of ways to interpret this, but I think we see it, I see it a lot. There's a lot of things that are falling through the cracks right now just because of the massive amount of need and work and information that's coming at us. And so I just needed to say that out loud. That's it. Thank you.
No, I appreciate your comment. Let me, just to revisit my comment about our best day. There was an uncovering of what is worst day, right? So we have a good understanding, and there's been, over the course of these discussions, a real the opportunity to hold the mirror up and say, where are we? But also from that, where are we headed? And I think that when we think about the future and when we think about planning, we on our best day is that refocus to, what does success look like, and where are we headed? What does the future look like for us? What is it we want to build together? And so that it's in that spirit that we ask the question, what is our best?
Thank you. I also have had some similar concerns based on the fact that a year ago, a pandemic was not on, it was just starting to be on our radar. And, the fact that we're sharing a public health, mental health director, quite honestly, it's been very difficult. And the fact that we also have not been at full staff in our mental health department. We've had just so many gaps. We've had a really hard time recruiting people to take management roles in our mental health department. And so we felt it. And I think our staff have felt it and our communities felt it. And so my hope is that at some point very soon, we will become fully staffed. And I know that we did just hire and offer the mental health deputy a position, and she accepted, and they'll be starting soon. But I think, had we done this process a year ago and known what we know now, I might have had a different opinion about this. So I hope that we can come out on the other end and be proud of this decision. But I think we all need to be really honest about what we're doing here, and we need to continue to have these conversations. And if it's working, then great. But if it's not, then we need to be open to having a different conversation. Deborah?
Yeah, I was not involved in this decision. But it's interesting hearing Dan's take and then hearing Shauna's take. I mean, my perception, especially over the last year, is that a crisis like the one we've been through points out how connected the health and mental health issues and needs can be. In that case, it makes sense having services that address those needs integrated in some fashion. The real problem appears to be that we don't structurally have the capacity to address both at the same time. So that probably should be where our focus is over the next year or so.
I'm going to let Jason and then Martha.
Thank you. I just want to say, I think it's, and we went through a very engaged process with both boards to come to the conclusion to merge the two. I'll say that a global pandemic came at a very bad time where staffing was being ramped up in both departments. And during that process, we also lost staff. So we lost essentially our deputy in public health due to an unfortunate accident. We were still recruiting for the deputy mental health commissioner. We were still recruiting for the clinical director, which is delayed by the nature of just the pandemic. And I think that, Frank not being here, I would just encourage that if we're going to have this discussion, we have Frank, leader of the department, back here. I would second what Deborah has said. The connectivity that is gained from the similar and aligned vision of both, it has, I think, has paid off just in the response that we've had to date. But I also don't know that it's fair to judge it as we're in the middle of recruiting for key leadership positions, as well as managing a global pandemic, as well as going through a strategic planning process, all to say. But I do think that Frank should be part of this conversation as we move forward.
I agree. Thank you, Jason. Martha.
Yeah, I would second what Jason said and remind, I just think there's no logic or reason or justification to evaluate this process at this point in a pandemic. There's nothing more abnormal than what we've been through. Yeah, there'll be other pandemics, et cetera. There's always going to be unusual circumstances. This is beyond the pale, right? So I would really urge us not to try to second guess a decision that we made with a very strong majority of the legislature voting. I'm not sure if Dan was the only one voting against it, but it was might have been. At any rate, it was a strong decision, very, very intensively discussed and researched. I worry that we undercut and demoralize our staff who are moving and spending their valuable time and energy on moving forward in the direction that by a strong majority we supported. And I think that's what voting's about, that you make a decision and we move on and we support the decision and support our staff in carrying it out. I really, really hope we don't second guess this decision based on a year of a pandemic, when, as Jason said, we were in the process of staffing up when all hell broke loose. So let's just please
Okay, Martha, thank you.
Relax and let our staff do what they've been tasked and want to do. Thanks.
Okay, Martha. I think what we all need to remember to do, though, is to have the conversation. And it's all right for us to question the process. Just because we are, quote unquote, committed to moving forward with the study and this discussion doesn't mean that we can't make it better. And as long as we're honest about the process and we listen to everyone's opinions, that's part of the process. Not everyone's going to agree with each other, but we all need to be heard. So, Jason, did you have another question? Nope. Okay. Okay. Thank you very much, Jeanette, for joining us this afternoon, or this morning still.
Yeah, no problem. No, it's my pleasure. Thank you, guys.
Thank you.
If it's all right with you all, I'm gonna I'll say goodbye.
That sounds great. Thank you.
Bye-bye. Take care. Be well.
Okay, next up, we are in line for the departmental updates. And let's see here. Why don't we start with Kate Shanks Booth from Youth Services?
Sure. Hello, everyone. Happy New Year.
Hello.
Just a couple things I wanted to bring to your attention. I forwarded this to Shauna and she was going to send it out to the rest of you. One of the things that we've been tasked with this year is looking at our training series, specifically as it relates to the challenges that providers and youth in Tompkins County are having around the COVID pandemic. And on, I believe it's the 26th of January from 11 to 12:30, we are having Melanie Little from the Mental Health Association in Tompkins County do a training called Supporting Youth are supporting young people's mental health and wellness. And so within the first 15 minutes of having this out, we had roughly 30 people sign up. So we're really excited about this. This seems to be something that they are hungry to know more about, and we'll continue to work with our partners to make sure that we are doing relevant trainings. Planning hopefully a quarter at a time. The other thing that I wanted to bring to your attention, back when we had our budget conversations earlier this year, Dan Klein had mentioned that he had been notified by the Family and Children's, well, someone around Family and Children's Services, that the Open Doors program, which provides respite for youth, was going to be canceling their services of January 2021. We are still having issues with this. We're trying to find a home. We're still working with the Learning Web and still have the TILPs, and we're supporting homeless youth, but particularly this particular Open Doors program worked with the 12 to 17 age, which is not just now a challenge as far as providing respite for youth that are at risk of running away or those that have, but it's been an ongoing issue. And the Open Doors program did a great job, but became really cost prohibitive for them to offer the program. We've been in conversations with Learning Web. We thought we had a situation where they were going to be able to add it on. We've also had conversations with the Advocacy Center, but due to the amount of budget shrinking that they've had, staffing issues, just capacity issues in general, they didn't feel at this time this was something that they could take on. We've been working with DSS. Want to just give a shout out to Kit and Todd Hessick from DSS. They've been wonderful. We have a meeting later this week to talk with Community Action. They did break ground on a shelter, a youth shelter, but that has been paused currently. So we're trying to get our brain around sort of what that looks like and what the timing for that needs to be. I've also got meetings with Glove House and the Cayuga Centers, who are not based in Tompkins County, but do provide a lot of services here. So I just want to acknowledge that this is a hole in sort of the services we're providing to youth, but we are actively working, and it's a strange situation to have funds but not be able to put those in any particular nonprofit right now, just because they are having capacity issues of their own. And so it is an issue we're addressing and working on. And so I just wanted to bring that to your attention. And we'll be updating Jason next week after those couple of meetings to sort of give him a sense of where we are and maybe how we can be creative and work with some different partners, maybe piece something together until we can find a definite home for this in Tompkins County. So those are the couple of updates that I have right now.
Great. Thank you so much, Kate. Are there any questions for Kate? I see no hands. Thank you for coming to HHS today.
Sure.
Okay, next we have Kit Kephart from Department of Social Services. Hello, Kit.
Hi, everybody. How are you? I don't have a real extensive update. I will let folks know that I'm going to call it a carport that we have installed at the front of our building that I think I had talked about last month. We were waiting for it to come in. It is fully installed now. It gives us a way to really provide a lot more protection to people from the elements as they come to our building. We are still seeing a significant number of people that are coming to our building. We are trying to work with people in various remote ways, but there's still a pretty large population of folks that come to our building. And so we have a whole screening process as most places do before folks come inside. But this also provides a lot more protection either as people are waiting to be screened, or it provides options for people to actually be able to grab an application, drop things off, even apply if they want or need to stay outside. It allows them to do that at a table and with a chair out there. So it's a much more comfortable and supportive way to serve people. So we're really pleased that Facilities has helped us kind of get that up and going. We are, I would say, probably the remarkable thing right now, more than anything, is just that we are managing every day to keep things up and running. At any given time right now, we're down 12 to 17 people that are out for various COVID-related kinds of issues, can't come to the office or can work somewhat remotely or not at all. So just kind of constantly shifting. staff or programs in such a way to keep things going while we are kind of struggling in that way. And we've got some staff that are contact tracing, as everybody does. So lots of work going on to kind of manage that. We're also trying to get a few programs back up and running that have been on hold for a while. Our DNA testing program for child support has been on hold while the courts have been closed, and we've kind of come to a place where those services are really needed. And so we're having to look at kind of how do we implement that safely and get that back up and running to serve people because we just don't know when the court doors are going to be open and people could go there. So, so lots of work going on to kind of manage things the best we can, considering the circumstances, and lots of excitement about the vaccine. I'm really glad to hear the updates and looking forward to that. So that's about all I have.
Great, thank you, Kit. Are there any questions for Kit? I see no hands. Oh, Deborah.
I want a picture of the new carport.
Oh, okay. I can get you a picture.
Yes,
It's the little things during COVID that we get
We
very
don't get
excited
out
about.
very much.
Well, I should have taken one this morning. I will snap a shot and I'll send it to you, Shauna, and then you can get it out to everybody. Does that make sense?
That sounds great. I'm happy to.
That's great. Thanks, Kit.
I'm happy to help in providing a little joy to people around here.
Great. Good.
Okay,
Thank
thanks,
you.
Kit. See no other questions? Thank you very much. Okay, Reverend Ken from the Office of Human Rights.
Good morning, everyone.
Hello.
Just a couple of things. As some of you may know, we, in relation to the WDIC reading and discussion group that's focused on the Ibram X. Kendi's book, How to Be an Anti-Racist, we have reached full enrollment of 20 participants. And so we've closed the registration for the reading group, and which Professor Batista Gonzalez from Ithaca College will facilitate. That reading and discussion group will begin 2 weeks from tomorrow and will run through February 17th. Last month, we completed our last program that we did in collaboration with Public Health and Mental Health and the Chief Equity Diversity Officer. That program was called Confronting Our Winter of Discontent, which focused on providing resources to address depression and loneliness during holidays and a pandemic. Kathleen Goldberg and Melanie Little did a wonderful job in addressing the issues, the focus of that program, which was held, I think it was December 21st. An upcoming OHR program that we're planning, I wanted to make you aware of. In the aftermath of the recent attack on the US Capitol, I've confirmed 3 or 4 panelists to participate in an event we're calling, Is This Who We All Are? Assessing the assault on the US Capitol. And I'm using the refrain that I think we've heard a good bit of in the aftermath of those attacks, in which there are a number of public figures that says this is not who we are. I think that's a question for debate and inquiry. Is this who we are? Panelists would include the directors of the Dutchess County and Orange County Human Rights Commissions and our own esteemed chair of the legislature, Leslie McBean Claiborne. I'm waiting for a 4th panelist to confirm. Most likely, this program will take place on Thursday, January 21st at noon. This will be the first of what will be a monthly slate of programs OHR will be doing. I'd like to loop back with my colleagues in public health and with mental health and with Dominic to begin to think about how we might incorporate once a quarter a program that will focus on public health and mental health issues during the year. So that's our sort of program trajectory going forward for this year. And so those are just a few things that I had to make you aware of.
Thank you. Reverend Ken, had you thought about possibly having a veteran on your panel? Because I've I have many friends that are actually veterans, and they were absolutely appalled at what happened at our Capitol. And it might be some nice insight to what they're feeling and what they've served and fought for so many years.
That's a good point. I will talk with JR, who might, and see if he might have some suggestions in terms of including a veteran on the panel. I think that's a very good suggestion.
Great. Are there any other questions or comments for Reverend Ken? I see none. Thank you very much for joining us today. Next, Lisa Monroe.
Hi. Yes. So I don't really have much of an update, but I just wanted to kind of speak to what Frank was talking about with vaccines and whatnot. So we've pretty much been inundated from 8:30 yesterday morning with phone calls from seniors trying to figure out what to do, which has been interesting because we don't have all the information all the time and it changes every minute. So but we are helping people navigate through the registration system. So if anybody knows anybody that needs help and they don't have friends or family, which is very common, you can send them our way. Our aging service specialists can help them register. And as Ann said, transportation is definitely an issue. We do have Gadabout tickets that we purchase from Gadabout that people, if they don't, can't afford it or if they, whatever, they're for anyone, they're not income limited. But we can give people Gadabout tickets to use. That creates a challenge as well, because to schedule Gadabout out and to have it meet the same time as their appointment and those kinds of things can be pretty challenging. But what our aging service specialists have been able to do is work through, navigate through with people, like how can you get there? How can we help you get there? Those kinds of issues surrounding not just registering, but getting people to where they need to go. And Frank, I think, left, but so I did not know about the pharmacies until Frank said that. So I'm actually meeting with the health department in a few minutes to get some public information out to people in print, because a lot of people don't get all the information that we're getting them on the internet and those kinds of things. So we're going to send some things out to our mailing list that we use for our senior circle, which is like about 10,000 older adults in the community. So to get that information to them in a way that is still going to be relevant is going to be challenging also, because it changes every minute. I've had also all the senior centers are now calling me, asking us for their support to support them signing their people up too, because they don't have staff and things like that. So we're getting slammed here too. Trying to navigate through all that. Again, the people that were calling us yesterday, it was a lot of reassurance that, there's no clinic right now. It's full. There will be a clinic, constantly reassuring that, yes, this will happen. And educating people that, you can't, people are like, I need to get out of my house, Well, there's more to it than that. First of all, there's a second dose. Third, you're still going to have to socially distance. You're still going to have to wear your mask, things like that. So there's a lot of conversations happening. And, like I said, I was going to meet with the health department a little bit here and try to get a handle on it and, help as many folks as we can. So that's pretty much where I am right now.
Great. Thank you, Lisa. Are there any questions? I see none. Thank you very much for coming today.
I'm actually going to jump off, Shauna, okay? Because I'm going to.
Okay.
All right. Thank you so
thanks,
much.
Lisa. Take care.
Thanks.
Next is J.R. Claiborne, Veteran Services Director.
All right. Good morning, everybody, and
Hello.
Happy New Year. Haven't seen everybody since last year. Just a few things happening with us. Of course, we are open. I am open and trying to make sure between phone calls and emails, keeping up with people. A couple of things that are happening. We are still maintaining our same programs. The Warrior Riders is actually our first session for the New Year's is happening this Thursday at 7 o'clock. Veterans Coffee House, we actually had our first session last
Great, thank you, JR. Are there any questions for JR? I see no hands.
All right.
Thank you.
Thank you.
Okay, next. Thank you, JR. Next we have, let's see here, we have 2 different groups here. We have the Human Services Coalition and
Shauna,
we have OAR.
your voice is very weird. You sound like Darth Vader.
Yeah.
Or Wolfman Jack.
Is this better?
Yes.
Good. That's what I get for trying to use headphones. Okay. We have the Human Services Coalition, and we also have OAR. And why don't we move forward with the Human Services Coalition? They are going to talk about a grant that they worked with the city of Ithaca with, and I'm guessing that OAR might be able to use information from this presentation to offer to some of their clients too. So Liddy Barger and Kathy Schlatter, welcome to HHS.
Thanks. I'm going to turn this over to Liddy in a minute. This is a grant that a group of people have been working on for the past year. Liddy representing our agency, Ithaca Urban Renewal, Laura Lewis, Carl Fear, and a few others have worked hard on this grant. We just had been working with the grantors, and just late last week, we were told that we are allowed to now speak about the grant, which we were not allowed to do before. And I'm going to let Liddy talk about it since she did a lot of the heavy lifting on this, and she's got a little PowerPoint.
Yeah.
Liddy?
Am I able to share my screen? I haven't actually tried. Yeah, okay. Yeah. All right, let's see here. Does that show up at full size for people?
Yes.
Okay, great. So my name is Liddy Barger. I'm the coordinator of housing initiatives at Human Services Coalition, for those of you who don't know me. So I wear a couple hats there. One of them is my continuum of care hat, and then the other one is sort of like housing for everyone else. And that is where this grant falls into. As Kathy explained, we've been working on this for about a year with enterprise community partners. It started as a learning network. There were 10 other communities involved in this learning network, and then we had an opportunity to apply for $1 million for our anti-displacement initiative. And we're fortunate to receive the funding at a full $1 million. So the purpose of this grant, which we call the Ithaca Anti-Displacement Eviction Defense, aims to prevent displacement from the city of Ithaca by preventing basically all avoidable non-payment evictions through a comprehensive network of strategies. So one of the things that we aim to do is basically sort of like beef up all available safety nets to city residents who are facing eviction in order to sort of like catch people wherever they're falling through. And we have added this component, which functions basically like guaranteed basic income. A huge focus for this grant is to work through a racial equity lens in order to keep the city of Ithaca the thriving, vibrant community that it is. Here's some of the data that we're working with as we're putting together this survey. I think most of us know that 74% of the city residents are renters. And it's more than just students. There's year-round residents who are renters, many of us, myself included. 56% of the city tenants are rent burden. That means they're paying more than 30% of their gross income on their rent. 41% of them are severely cost burdened. And of those cost burdened folks, the burden really rests on Black and Latinx renters. So there's a huge disparity in the numbers of people in those populations who are severely rent burdened. One thing to sort of know is that in New York State, there's no requirement to keep any data publicly available or otherwise regarding evictions and their outcomes. Ithaca is no different and does not currently have a database that tracks any evictions. So in 2018, Carl Foyer, who was part of our team, went in and did some sort of basically recon work to get some data. What that data revealed is that out of 70 warrants of evictions, which means people who went all the way through the process, all the way to an actual eviction, 54% of those households were Black households. And we actually know that most of them were Black female head of households, so single moms. And one really shocking bit of data that he found when he was doing that work is that only 3% of people in our city eviction court had legal representation, and that's compared to 100% of landlords. These are our partners. These are all people who are funded through this project. We are still looking for some partners in terms of doing our affirmative marketing and some other strategies. So I'm open to hearing suggestions about that later. This is who we're working with now. And so, like I said, it's a lot of strategies. It's sort of like a many tiered plan to prevent displacement from the city of Ithaca. And I'm just going to quickly go through some of those strategies with you. So our first strategy, and they're not really in a particular order. Strategy one is to support the housing hotline, which is able to provide tenants with sort of like the lightest touch service that may prevent their eviction. So the housing hotline is nested within Ithaca Tenants Union, but is actually a project of the Cornell Law School. It's staffed primarily by law students. They're all supervised by an attorney, and there's a mechanism with which people can receive what's called brief legal advice through that process. So I think that is pretty self-explanatory. Another strategy that we're supporting with this funding is to support an eviction monitoring project to ensure fairness and build that database that is lacking in our community. So going forward, when eviction court opens again, all eviction cases will be monitored and recorded for fairness. This is going to give us that data we need going forward. And it also is modeled on a project from New Orleans, which found that basically just having monitors in the courtrooms resulted in less evictions for low and moderate income people. The third strategy is to increase access to full scope representation for people in eviction proceedings. Using funding from this grant, we're going to be able to increase the number of tenants by about 50 who are eligible to get full scope representation for their eviction cases. So some of those people will be represented by Law New York, which has been funded to have an additional housing attorney, and some will be represented through the Cornell Law Practicum. and also a Cornell Law Fellow that's coming on as part of this grant. Just so people know, the housing hotline that I talked about earlier is sort of the triage, the center of the many spokes, and will be referring people directly and with a warm handoff to the place that's going to be providing their legal representation. And they have a strong system in place already. Strategy 4. So this one lives at Human Services Coalition. And we call it the Housing Stability Supplement Program. That's actually wrong in there. So tenants who are in eviction court and have sort of gotten as far as already being in an eviction court are going to be supported by what we're calling right now an enhanced 211 navigator. That name may change, who is going to personalize their navigation through any available rental assistance projects, and do warm handoffs and work as to ensure that people are getting any programs that they're already eligible for. If somebody gets sort of navigated through all of those programs and are not able to be served another way, they become eligible for this income supplement, which works pretty much the same as a guaranteed basic income program, if you're familiar with those. So the idea is that that income supplement is going to allow tenants to enter into a realistic repayment arrangement with their landlord that allows them to stay in their units. So they're going to be getting $300 a month that initially will be used as sort of like a bartering chip with landlords to say, listen, we have this $300 a month coming in. It's going to go directly to you. Enter into a repayment agreement for the arrears, stay in their housing. When the repayment portion has been satisfied to the landlord, it converts into a direct income supplement for the tenants. They are eligible to receive that $300 a month, either going to the landlord or themselves, for a total time of 18 months. It basically works out to being $5,400 per participant. Another strategy is to support tenant and community education about their rights and use people power to do some of that. So there's currently no updated tenant rights and responsibility handbook in our community that reflects our new 2019 tenant protections that the state passed. So we're going to get that all updated, disseminated, and really focusing on communities of color with that information. So going directly into West Village, Chestnut Hill, some of the other known places that have a high concentration of community people of color, and getting that information into people's hands. The other strategy is to sort of increase housing literacy across our human service providers. So we have a goal that a person in need, a tenant who's at risk of eviction in the city of Ithaca, could theoretically walk into any agency, and that agency would at least know where to orient them, how to direct them, and get them what they need. Those are the basic strategies. Here are some of our deliverables. I mentioned some of these as I was talking. And some of this, I will say, without saying too much more, may change a little bit. We've had some opportunities to apply for some matching funds, so we might be able to increase the scope of some of this project. But these are our deliverables as is. One piece that I didn't touch on in the PowerPoint earlier is that we are funding a paralegal at Law New York, who's basically a large part of their role will be to develop this pro bono lawyer pool for eviction cases. So we're adding the paid lawyers, and then we're looking to have a more robust pool of pro bono lawyers doing eviction cases for people. This is the core advisory team. I think we've mentioned that a few times. We met yesterday with our partner board for the first time. We have representation from all of the funded partners, and now we're looking for some community partners. And I have reached the stage of questions. I saw some chat things happening, but I couldn't see them, so I'm going to stop my share if there were questions. This grant is amazing, really is. Oh, those are not questions. Do people have any questions that I can sort of theoretically answer? Yes.
Henry had actually written.
I can't hear you.
In our. Hello?
Okay, now you're up.
We
Okay.
didn't hear the first thing you said.
Oh, Henry had actually written in the chat, this grant is amazing.
Oh, yeah, I saw that one. Yeah.
So absolutely is.
It's
Are
great. We're
there,
excited.
Yeah. I see that Deborah Dawson has her hand up.
Yes, thanks. Liddy, this is wonderful. Henry's right. This is quite amazing. I do have a couple of questions. You mentioned that there was going to be a Cornell Law Fellow hired to supervise, I guess, Cornell's participation in this. No?
There's already a lawyer supervising Cornell's participation in it. It's a new position for a housing specialized Cornell Law Fellow that will actually be working at Law New York.
Okay. Now, are you paying for that out of the grant, or is Cornell?
We're paying for it out of the grant.
Okay. And then you mentioned there was funding to Law New York for a paralegal, I guess.
There's funding to Law New York for both a lawyer and a paralegal.
So is that over and above the county's funding to Law New York, and how do they coordinate?
We do have are you talking about the EIHP funding, the early intervention homeless intervention? It's different, I guess is the answer. So the things that have been funded by us, by Enterprise, or by whoever we are.
Whoever you are.
Support a housing attorney at Law New York, and then a paralegal whose primary role is creating that pro bono pool. The EIHP person is a paralegal doing slightly different, I'm sure there will overlap, but different work. These are people who are already at eviction stage needing representation.
Thank you.
And I know they hired for that position, the EIHP position.
Well, this is great, and I do hope that you manage to get some collateral funding from other sources, because we're just looking at a tsunami of hurt.
Yeah, I mean, I know we've all been sitting here a long time, and I don't need to take the conversation astray, but I have been fortunate to be getting some feedback from a couple of surveys that I put out about like where people are in terms of this, because we keep talking about a tsunami and like an eviction crisis, and I really wanted to see what that looked like in our community. It's been pretty revealing to see like how many people feel like they're at risk of eviction, how many landlords have tenants at risk of eviction. I'm hoping that there's going to be some mechanisms that kick in pre-moratorium to support folks so that we don't have to wait until people have reached that eviction crisis. I would like to, and we're looking now that this grant that I just presented about was written in the first, well, some of it was pre-COVID, but really in the first moratorium, we did not anticipate having an extension all the way through May, which is great. But we're looking at sort of doing a little pivot and trying to start earlier if we can on prevention.
So let me ask, if we don't do these early intervention things, how bad is it actually going to be? Do you have any sense of that?
I have some sense. I mean, it's not great.
No, I didn't think it would be.
But without taking up too much time, I had 100 so far. I have a survey open right now. I have 185 respondents from the tenant side and 45 respondents from the landlord side. What tenants are saying is, yeah, I'm not really that worried about getting evicted. I've been prioritizing my rent over other bills, which is concerning to me.
Yeah.
Because that, they have other bills. What landlords are saying is people are not paying their rent. They're seeing huge amounts of arrears, and they cannot wait to be able to start evicting people, essentially.
Oh, geez.
So the surveys mirror each other in questions because I wanted to be able to compare them as much as I could. And the main thing I'm learning is tenants and landlords have a very different perspective on what's happening. It's like the best answer I can give. But the average amount of arrears that I'm seeing is about $2,800 that people have, which isn't insurmountable, but is also a lot.
Well, if you're already severely rent burdened, though, $2,800 is a mountain you can't climb.
Well, and the other thing that it's like worth thinking about is if the eviction moratorium sort of like is open season and everybody gets evicted, those folks are all going to move into the apartments that were recently vacated by other eviction people who have been through an eviction. So it's kind of just like swapping your tenants. And I think that there's something to be said for prioritizing, if the relationship is salvageable, prioritizing staying in the housing that you're already in, because it doesn't really benefit anyone to just sort of like, it's like musical chairs, right? And then one or two people are not going to find the chair and they're going to enter the homeless response system.
It's good for moving companies.
Yeah, sure.
It's really bad on children and families.
Bad on children and families. Yeah. And yeah, staying in schools and all of those things. And we do know that the majority of people who experience an eviction do not enter the homeless response system. That's sort of the lore of, or there's a lot of fear around that, but most people who go through an eviction actually just end up living in a more expensive, less good, further away from what they need unit, or friends and family. People who are likely to enter homelessness are those that have experienced homelessness in the past, have had more than one eviction in the past. And there's some other sort of markers. It's not, there's a way to predict who's going to enter homelessness after an eviction or not. And so we can scale up our systems now to support those that are most likely to enter homelessness.
And just one last thing, it would be lovely if you could share your PowerPoint.
Sure, I'd be happy to. I'll send it to Shauna.
Great, thank you.
Liddy, how does one become a partner?
Would you like to be a partner? I'd be happy to send you more information. Okay, great. I'll be in touch.
Or I should say OHR.
Right.
Which I guess is me.
Obvious. I'll put my email in the chat. You can send me an email. But we are looking for partners, community partners.
And Reverend Ken is our fair housing officer here in the county, so it really makes sense. Let's see here, Henry Grandison.
Yes, thank you for the presentation. I was wondering, Kathy, does Judge Rowley know about this process? Remember this group that was meeting?
Yeah, I know that the group has reached out to, well, this is just in the city of Ithaca. Just the city. So basically we've reached out to the two city judges. But yeah, I mean, we were only told late last week that we are actually allowed to talk about this. So we do have some other people we want to get information out to. But I wanted to share it with you because your meeting was today.
Great.
Okay. Also, the landlord association position that you were meeting about last year, are you guys going to revive that meeting?
We have a part-time landlord engagement specialist working at HSC at this time.
And he's been reaching out to landlords individually, meeting them, speaking with them. So yeah, we're trying to do this on both fronts to work with. We're not anti-landlord, anti-tenant. We are just into helping people get stable housing and be able to keep it. So, and we're doing other little projects around the landlord thing to really help landlords allow more people with housing choice vouchers to live in their apartments. So
great. Well,
because it is the law.
Liddy,
Yes. Also, Liddy, in terms of
Henry, can we wrap it up a little bit because we still have one more presentation?
Sure, I'm done.
Okay,
I'm done.
Liddy and
Fine,
Kathy,
thanks.
thank you so much for coming today and presenting. You're always welcome to present, especially whenever it's such great news like this.
Thank you. And if you
Thanks for having us.
Just shoot Liddy an email or me an email. We'll be happy to talk to anybody.
Great. Thank you so much.
Thanks for letting us present.
Yeah. Thank you
next-
all. Great work.
Yes. Next up is Deb and Richard. Thank you so much for waiting patiently. I'm sorry, whenever I invited you initially, I didn't realize that our meeting was going to go this long. I could have at least saved you a little bit and offered to have you come in at 11:30 or so. So my apologies.
No worries. I learned a lot, so I was glad to be here. I'll try to be brief. I really want to first let the committee know that through the leadership of Liddy Barger and the Human Service Coalition, a lot of the not-for-profits in the community coalesced into kind of an outreach team. It grew organically. It was pretty exciting, and we had weekly Zoom meetings where a lot of us kind of pivoted and changed our mission to address the needs of our clients throughout this pandemic. So first I wanted to acknowledge that. And then there are just a lot of other really valued partners on that team. And each of the partners brings some different skill sets. And I think it's really made a difference and has helped alleviate the impact of the pandemic on our homeless populations. In addition, we've been working with, and I'll let Richard talk a little bit more about it, but with food delivery, we've taken that. We've been delivering food to the advocacy centers, shelter, Endeavor House, and to parts of West Village too, and the hotels where the homeless are housed. So this, as the pandemic, has done across our country, has really impacted our most insecure population most severely. But all these efforts, the other thing I want to say about the outreach team is that a lot of these activities were all based on a public health model about what can we do within good public health guidelines to minimize the chance of transmission and exposure to COVID, both amongst the homeless population and those who serve them and other community members. And I think we've done pretty well with that. It's really been pretty amazing that there hasn't been a major outbreak in the encampment, of COVID. We do have a hepatitis A issue going on in the encampments, but there's also, since REACH has started to do telemedicine and actual outreach into the encampments, foot rot, the jungle rot, is almost eliminated right now. So this public health model has really gone beyond the pandemic and done some exciting things. So I first want to acknowledge our partners and really the lead that Liddy took in convening us and getting us discussing things in as common a language as we can. We come to this from different perspectives. OAR's perspective is from a harm reduction perspective, and other of our partners don't share that to the same degree. And so a lot of it's been difficult mediating some of the ways we deliver services and the culture. So I was struck by the discussion of the mental health and public health discussion of culture. I think we've been through a little microcosm of that through this outreach team. So I will let Richard speak for a few minutes now, just about because he's been our person on the ground. Our office has been open since mid-May. We have over 200 people a week coming in. We're limiting the numbers at a time. People do have to, I have to look at that carport myself because we have people huddling out front. But Richard's the one that's been from the very beginning out in the encampments, working with other team members for OAR. So Richard.
Thank you for inviting me. That didn't leave much to say, but what I wanted to point out, she covered basically everything. I want to thank you, the committee has been amazing. But what we should be really proud of, and you started this meeting by saying how proud you are of Tompkins County in vaccinating and being able to respond to the pandemic. It has been 10 months. And for 10 months, we started with a relocation of people that were already in the encampments. They had to be relocated because of the dredging project that was going on. And now we're ending 10 months later with another relocation, I think, from Cherry Street, right? And throughout this 10 months, we have responded reflectively to the crisis. Every organization has reconfigured itself, reimagined itself, and somehow came together to produce a project that has kept the curve from ballooning out. I mean, we have kept the people that are in the encampments supplied with provisions, food. We have kept people in West Village supplied with provisions and foods. We have in the Econo Lodge, in the hotels, in the shelters, anywhere we could reach it. And we have effectively kept them safe and healthy. Like Deb pointed out, we have practically eliminated foot rot. We had one case of Mrsa, which we responded to by providing laundry, because all the laundry places were closed. So we provided coins for the laundry project. We provided some storage so people could put storage stuff in case they were going to rehab or something like that. We provided any provision they can. We have one case of COVID in the encampment. One person became infected. We immediately did contact tracing to 2 more people. We isolated them. We had them isolated in the encampment, and we provided them with everything they needed. They didn't have to leave, and we tested everybody else in the encampment, and there was not another case of it. The people were sheltered for 2 weeks, and now they are going about their business, but they're safe. And hopefully the vaccination will be given to them soon, and we don't have to worry about that no more. What we have done is we have sort of created a thing, organic thing in the encampment that has both kept our populations, our communities safe. It has reduced a lot of incursions into the encampments, and it has kept this population vibrant and safe. So today, we started out like 4 months ago, 3 months ago, we had 56 people out there. Because of cold weather policies and the efforts of the outreach workers to house and shelter these folks, we went from 56 people to 21 people still out left in the encampment. Most of them are sheltered in hotels under the cold weather policy. Many of them are housed. We found housing for them. We have moved their property. They have practically left their camps, destroyed them, broken down, and they're no longer going back there. So the effort has produced a movement to try to get housing. It has developed relationships of trust with this community that has facilitated housing. And it's all thanks to these efforts made by all the organizations, including Second Wind, St. John's, Family Children's Service, Reach Medical, of course, Loaves and Fishes, and Solid. Everybody has contributed their part, from food to medicine to provision to relationship to counseling to talking to holding hands while they navigate through the DSS process.
Why don't we also, I think some numbers might help. Yes. There have been over 5,000 meals. 6,000. Or 6,000, we're up to 6,000 meals.
In addition to Reach, we have collaborated with OLA, Ultimate Reentry Program, Bickering Twins, Shortstop Deli, the WIT Cafe, and we have provided over $6,000 meals in addition to the ones that are given out by Loaves and Fishes. And these meals were delivered not only to the encampment, because there were 130 meals every Tuesday, but they were delivered to West Village, to the Econo Lodge, people that were quarantined. I mean, we had just covered every base. Everybody just communicates. I could pick up my phone right now and call a lady, which I won't do, but it could be done because we have developed that type of relationship with DSS, with Reach Medical, with everybody. And it's like an incredible process, incredible experience. I want to thank everybody for just allowing it to happen like this.
The only other thing I just wanted to hit on too quickly were the laundry project, which has gotten funding from the IURA and others. And so what we've done is, Richard alluded to it, we have coins available for people who bring their bags of laundry to OAR, and they've been able to do their laundry, their bedding, and keep clean, which obviously helps in the case of a pandemic. And I don't know how many thousands of pairs of socks have been.
We have given out over 4,500 pairs of socks.
So that's just a kind of a brief summary that kind of celebrates how this community pulled together.
And now we're moving towards cleaning some parts of the encampment. We already started that project. We started discussions with that, and hopefully this year, as soon as things start going out, we'll be going out there and starting to clean and try to motivate people to get engaged in their spaces.
Great. Well, Thank you so much, Deb and Richard. Richard, I have to say your name alone, I have seen for many, many years as someone who enters into the trenches. And although I've never personally met you, I can say that we know that you have been the person behind the scenes, and you're not always the one that gets all the credit. You're not always the one that's in the newspaper or pictures in the newspaper, but know that your name has been around and we've heard of you. And we certainly honor you today because we know that you're the guy doing the work behind the scenes and in the trenches. And you know, I think we've talked in this committee before about how whenever DSS enters the picture, very honestly, many times there's very little to no trust with our homeless population. And, you know, I think whenever Liddy or Richard or Justine at Reach or Liz or Tammy or Natalia, whenever they enter the scene, instantly there's a sense of calm and there's a sense of trust. And we just thank you so much for being you and for doing the really, really hard work. It takes someone very special, and we're so, so fortunate to have you.
I'm humbled and honored. I'm just honored that they allow me to help.
Wow. Well, thank you. Thank you.
Thank you.
Are there any questions for Richard or Deborah? Okay, I see none. We do have some minutes to approve really quick. And can I have a mover for December 21st, 2020? Moved by Dan, seconded by Deborah. Are there any comments or questions? I see none. Let's vote. Dan Klein?
Yes.
Amanda Champion?
Yes.
Deborah Dawson?
Yes.
Glenn Morey?
Yes.
And I am a yes too. That is unanimous, and those minutes are approved. Thank you all for attending today, and I hope everyone has a very nice January.
Thanks, Shauna.
Bye. Thanks, everyone.
Bye.
Take care.